Hello, I am Dr. Mannu, and I want to talk about a health issue that I've observed concerning people who suffer from hay fever and allergies and take antihistamine medications. A few days ago, a patient came to the clinic for a diagnostic scan, and the only problem she complained of was a persistent cough and mild breathlessness. The scan picked up the cause of her problems, but also detected signs of brain degeneration. Very typically, our scan will pick up the three weakest systems or regions in the body. But when an organ flags up as either inflamed or degenerated, it usually means that the underlying problem is progressing. So when she came for her review a few days later, I told her that the scan had picked up signs of brain degeneration. And that's when she revealed that for quite a while she's been worried about her worsening memory loss, and she'd even informed her doctor about it, who didn't take it seriously. I was concerned because the scan didn't pick up any underlying cause for the brain degeneration. Yes, she had narrowing of the arteries of the brain, but nothing more than I had observed in a lot of people her age who didn't have any signs of brain degeneration. And that's when I noticed from her list of medications that she's taking a daily dose of an antihistamine, and she's been doing so for quite a few years. Then it clicked. You see, in recent years, several clinical studies have linked antihistamines to brain diseases such as dementia and Alzheimer's disease, especially for the class of antihistamines known as anticholinergics. Anticholinergics suppress the production of brain chemicals called acetylcholine. And this chemical is vital for maintaining and preserving our memory. So yes, these anticholinergics will suppress the symptoms of hay fever and allergies, but in the process, they would also suppress this vital brain chemical called acetylcholine. In fact, one study found that antihistamines, especially the anticholinergics, will increase the risk of developing Alzheimer's disease by 63% in those taking it for over 3 years. Now, there's no doubt that antihistamines are a lifesaver for people suffering from chronic allergies and hay fever, especially if this is compromising your quality of life. However, it's important that you realize that antihistamines should never be taken continuously for more than a few weeks. Antihistamines are symptom relievers. They don't cure the problem. And the primary reason for hay fever, allergies is a dysfunctional immune system. And this dysfunctional immune system creates a state of hypersensitivity to common environmental chemicals that would normally not cause problems to most people. Antihistamines are great for short-term relief, but if you have chronic hay fever and allergies, then it is important that you use an air filter to filter out the pollen and dust particles in your home. Of course, you will be exposed to contaminants when you leave your home, but remember, we spend most of our time in our homes, and reducing the contamination in your home will allow your body time to recover in between exposures. It's also important that you start to work on the immune system to boost your immune system. And one of the most effective immune boosters is vitamin D. In the meantime, if you're taking antihistamines and you're already experiencing symptoms such as memory loss, forgetfulness, foggy-headedness, dizziness, then you really should consider stopping the antihistamine.